sister and a niece, 2 nieces actually, and they were so shocked when we found out about my breast cancer. They've always been very much interested in continuing to have their checkups the way they should. But I have to mention to you that my sister went a few extra months without getting a mammogram done. And when I found out about that, I got really angry with her, because it makes you so frightened to know that this is something that can be detected if we do things, if we take those right steps to make sure that we're getting the test done, or we're doing those self-exams every month. So now and even if they miss a day, they'll always very quickly try to reschedule that, because they don't want my wrath, because they know that that's something that's a pet peeve for me. I do just beg, please, everybody, make sure you do those self-exams. They're so important.
What would you like to share with young people about your experiences, and do you have any recommendations or suggestions for them?
Well, I just admire you so much as a scout, number one, because I think that what you're doing to get the word out to other young women, teenagers, and young adults is so very important. I think that there's not a lot of emphasis on doing breast exams, and the emphasis needs to be placed there. I can remember that my husband and I had been to a Washington Redskin preseason ball game, and I truly thought that maybe I was just feeling discomfort in my breast because I carried a big tote bag and it had a lot of weight to it. And then when I felt the lump, I knew that it was something that had not been there. Had I not been doing those breast exams, I wouldn't have had anything to compare to. So I really wouldn't have really known what I was feeling. By me finding it and then going to the doctor and saying, I need to go back and have a repeat mammogram. I'd had a mammogram probably within 9 months to finding the breast lump. But being proactive and asking the physician to help me with having another test, another mammogram to see what was there, I feel like certainly enabled me to get the treatment and the help that I needed. Another recommendation that I think is so important is that people become sensitive to the needs of cancer patients. When we see someone that might have been going through chemotherapy and lost their hair, or have a different appearance, we never know what they're truly going through. So it's important to be compassionate with them. You see some people that just mock fun, and that's not the thing to do. So my pride in you right now is knowing that you've got something that you're going to be able to share with people to maybe change others' ways of looking at cancer and looking at people that have gone through cancer. Because there's so much that we could do to reach out and make a difference in someone's life. I think too, focusing on the fact that there are support groups and there are things that you can do to help out. So many people don't realize that there's a lot of people that can't afford wigs to wear if you lose your hair. But you know yourself, you want your hair to be pretty and look good and want it styled different ways. But when you have no hair, what are you going to do? So there are different organizations that could take up money to help buy wigs for people, or maybe scarves for people. So there's a lot of things, a lot of recommendations that can be done through scouting, a lot that can be done through your church, a lot can be done in general just by people that you know, to really let people and others know that it's so important for other people to have what they need when they're going through something like that. I'm very proud that McLeod does offer a lot of support services for individuals that are going through different types of cancers. And there are also other organizations within the community that does that. I think also it's important that you stay involved with those close friends. I know some of my friends didn't pick up the phone and call as often as I thought they should. And the message that I wanted them to know is, my body may have changed because I had breast cancer, but my heart's the same, my mind's the same, I'm the same person. So reach out and be there for them, be a true friend.
Thanks.
You're welcome.
This is Joy Lewis with Cadette Girl Scout Troop 402, and I'm interviewing Dr. Michael Pavi of he's an oncologist with Carolina Healthcare in Florence, South Carolina. Dr. Pavi, thank you for agreeing to meet with me.
Sure. My pleasure.
Okay. When is a patient referred to you?
Well, breast cancer patients can be referred to us before they even have the diagnosis. Sometimes we'll see people who just have a suspicious mammogram, or more commonly they're referred to us after they've already had their diagnosis made, and they are talking to us about whether they're to have surgery or radiation or chemo or whatever. So it's all along the different spectrum, but most often after they've already had a diagnosis made by a biopsy of some sort.
Are you part of the diagnostic process, or do you get the patient after the diagnosis of breast cancer has been made?
It depends. Most of the time the breast cancer has been already diagnosed by the time they come to see an oncologist.
What is the very best method of screening for breast cancer at the very early onset?
Still, the mammogram is the best way to screen for breast cancer, utilized starting about the age of 40 in women, and maybe earlier if they have a family history or high risk factors like they have genes that they could carry for breast cancer.
What are the different ways of diagnosing breast cancer?
The only way really to diagnose breast cancer is with a biopsy. You have to have a piece of tissue under a microscope to make the diagnosis. You can be suspicious of the diagnosis from what it looks like on x-ray or from a lump or what you can feel in the breast of a patient, but the real way for a diagnosis has to be through a biopsy.
What age was the youngest breast cancer patient you have treated?
Oh, probably 20.
What makes a young female at higher risk for breast cancer?
Most commonly that's genes, that she has a gene that's passed down through the family that causes her to have a high risk for breast cancer. It's a genetic disease.
What percentage of your breast cancer patients have a 5-year survival rate?
Oh, the 5-year survival rate with breast cancer is well up into the 80 to 85%.
Are you seeing more breast cancer patients at a younger age?
No, I don't think so. Breast cancer is more common in older women. It's just when a young girl gets it, everybody's, of course, very distraught by that activity. But quite frankly, we see a lot more women who are in their 70s and 80s with breast cancer than we do in their 20s and 30s.
What determines the method of treatment you decided to use?
It depends on how big the breast cancer is and whether it's spread into the lymph nodes under the arm or whether it's spread to other parts of the body. Sometimes we just use local treatments just for the breast itself. So it depends upon how extensive, how big it is, and how widespread it is.
What are the treatments available to breast cancer patients?
Well, there's fall really into about 4 different groups. One of them is surgery, which is removal of the lump or the breast itself. And then there's radiation, which could be radiating the breast after a lump's removed. And then there's chemotherapy, which are drugs that are given in the vein to treat breast cancer. And then there's hormone therapy, which are usually anti-estrogen type of medications, usually pills that are given by mouth to treat breast cancer.
What determines a patient's course of treatment?
And mainly by their stage. Otherwise, how big is the tumor, whether it involves the lymph nodes under the arm, and also the receptors, which is the way we study the tumor to see if it's sensitive to certain drugs and certain hormone therapies.
Does everyone respond to the same treatment the same way?
No.
Okay. In using a mammocyte for treatment is using a mammocyte for treatment being used for breast cancer patients?
Yes. Yes.
Is this a more efficient way to perform radiation therapy?
It's a specialized way, I would say, because the patient is able to do it over a few days as opposed to over a number of weeks. But there's only a small percentage of women whose tumor is of the right size and how close it is to the skin and things like that that make the mammocyte helpful for them.
At what stage would a patient start receiving palliative care and then hospice?
Well, it's after the breast cancers come back on them. It's widespread. They're weak. They're not going to be taking any further chemotherapy or radiation. They may be homebound. They may not be able to get out of bed. That's mainly the palliative care and the hospice group.
What kind of support is available to breast cancer patients here in Florence?
The American Cancer Society has a support group. We have all the different radiation, chemo, surgeons, all the things that are needed. McLeod Hospital has a special nurse who's a breast cancer specialist that helps take patients and navigate them through the trials and tribulations of the diagnosis and the treatment.
What other medical staff do you rely on in treating your patients?
Well, we rely on the surgeons. We rely on the radiation doctors. Of course, the nurses, the physical therapists, all of the different allied health people help us to do the x-rays and to do the scans and help patients with their side effects of treatment.
Who all is involved in the total care of these patients?
Well, usually what we do is we have a conference every week where we present the patients, and at that conference there's the oncology, the radiation, the surgeons, the nurses, social workers, physical therapists, medical students, people like that. And we present the case and we talk about what's the best option of radiation or chemo or mammocyte or mastectomy or lumpectomy. And those things are done. We do that every Monday. We usually present around 10 cases, follow, because we're seeing about 100 to 150 new breast cancers a year here.
What percentage of surviving breast cancer patients return with a recurrence?
Probably about 50%.
What are their chances of survival the second time?
There's no cure for recurrent breast cancer, or there's cancer that comes back in another part of the body. Women who've had one breast cancer can get a new second breast cancer in their opposite breast. Now that can be cured because that's not a relapse of the original one, but a new one. Those are two different things. But a woman who has a relapse in her lungs or her bones or another part of her body can't be cured, and the average survival on average is about 2 to 3 years.
Are there any foods that can be eaten or vitamins that can be taken to help prevent the occurrence of breast cancer?
Not that I know of, although a good healthy diet is good. There may be some evidence that keeping your weight down into a reasonable range is good, and limiting your alcohol intake to moderate is also good.
How important is exercise in prevention?
It probably plays a role, but I don't think it can be really quantified exactly, okay?
What message would you like me to relate in my DVD to Girl Scouts across the country?
Well, I think that they should be aware that it's a disease that's getting better and better as far as our cure rate is concerned. And if there's a family history in their family, they need to talk with their mother and father about that. And those should be just aware that it's something that happens, and that if they have a family member or a friend whose mother gets breast cancer, they should be open to talking to them and not being afraid to be around them because they have an illness. Sometimes people get afraid to say something, but I think it's best to just talk about things and be open about it.
Today I'm going to be interviewing Dr. Navy. He's a local psychologist here in the Florence area. Dr. Navy, thank you for letting me interview you today.
No problem.
I'm just curious about how can people find and maintain a healthy emotional life?
Well, a healthy emotional life involves all the aspects that you would consider healthy living. It involves, believe it or not, healthy nutrition, healthy activity. It also involves healthy relationships, which is something that people often don't think about.
What have you seen happen to people who don't maintain a healthy emotional lifestyle?
Well, research has shown for years that people that don't pay any attention to their emotional life are ill more often. Their pain is worse when they're in pain. And they're more likely to contract major illnesses because not being emotionally healthy lowers your immune system, lowers your ability to fight off illness.
Is it difficult to maintain them?
No, it's a matter of commitment. It's a matter of making it a priority. When people don't maintain a healthy lifestyle, it's not because it's so difficult or because it's so confusing, it's just because it's not a priority. We have to make it a priority.
Does a strong faith or a spiritual life help?
Research has shown for years that people that have a strong faith and are involved in a spiritual life tend to be generally healthier. And that's just a simple statistical reality, okay? People can answer that question for themselves as to what makes that happen. But the truth is, people that have a healthy spiritual life tend to be healthier in general.
Does medication help someone who is depressed?
Well, medication is an important part in a treatment plan for someone who's having an emotional problem. The important thing to understand is that there's no one cure for being depressed or being anxious or any other emotional problem that we might talk about. Medication is not going to solve everything. What's dangerous is when people look to any one thing, whether it be psychotherapy or medication or anything else, as the cure for the problem. Because the only thing that's going to permanently fix an emotional disturbance is the person themselves being committed and involved in changing their life.
Will this medication increase their risk of cancer or other diseases?
As far as I know, there's no research that shows that antidepressants have that as a side effect. So I guess I would say no to that. And then again, one could make the argument that not treating an emotional problem might leave someone open to more illness.
Do patients seek therapy prior to any medical or surgical procedures of breast cancer, or do they typically look for support afterwards?
Generally, people treat things after something blows up. Okay? Preventative treatment is so much more effective and so much more helpful. But we all tend to seek treatment only after something has exploded and there's a huge problem. So most of the time, someone is going to seek psychological treatment only after they've had something bad happen. And that's unfortunate.
Is there anything special you'd like to mention in this educational DVD on breast cancer awareness for Girl Scouts?
I would hope that the viewers of this DVD would consider the impact that their emotional life has on their physical health and would all make a commitment to considering their emotional health as a priority in their life, meaning that they make a commitment to a strong spiritual life, make a commitment to a healthy lifestyle in all its aspects, and make a commitment to healthy relationships with the people around them. That will help them stay healthy physically, long term.
Right. Thanks so much.
You're welcome. You're welcome.
I'm speaking today with Dr. Fox. He's the medical director with the Palliative Care and Hospice. Thanks for letting me interview you today.
Thank you, Judy.
Okay, at what stage during a breast cancer patient's progression would they be referred to you?
Well, oftentimes, as you know, palliative care is support for patients and their families when threatened with a serious illness that could result in progression and death to a lot of those patients. Palliative care is a multidisciplinary approach by which patients and their families may benefit from counseling, support, talking about the illness, talking about hope, not giving up. When you hear the word cancer, it's very scary. Scary to the point where you think about, am I going to die? Am I going to suffer? Reassurance and hope is part of palliative care. Support for those patients and their families, not just medically, but emotionally, spiritually. Sometimes they worry about, why God did you let me have this illness? And it's important to recognize that there's a lot of people out there willing to help you. So anytime throughout those illnesses, when you first get diagnosed and throughout the course of their illness, patients may benefit from comfort measures and support.
What can you and your staff do to help these patients?
Well, sometimes it's just listening. Sometimes it's listening to what the patient's worried most about. Sometimes it's understanding that they're not the same as everybody. That one patient is most concerned about her in the terms of breast cancer. When approached with patients who are dealing with this emotion, it's important to talk about treatments and aggressive curative things, but equally so, sometimes the cure of cancer is associated with a lot of pain, a lot of other ailments that may affect you, such as nausea or weight loss or infections. Those are things that are necessary to treat too and support the patient while they're trying to get this disease treated with appropriate treatments.
Is there any hope for remission when after a patient comes to you?
There's always hope for remission. Breast cancers are curative. It's important to understand that people need to have choices about their treatments. Sometimes people who are in their life where they may not wish to have aggressive chemotherapy, sometimes that's a choice. Some families will say, my grandmother was one of those people, as a matter of fact. I'm ready, Grandpapa died, I don't want to be prolonging my life with aggressive chemotherapy. And those patients do have a choice about whether they want treatment or not. But regardless, there are many treatments for breast cancer. You can't ever lose sight of the fact that remission or cure in breast cancers are curative these days with aggressive chemo, radiation, surgery type of procedures. But sometimes when it's extended beyond the breast area, for example, and there's metastases, people need to know that sometimes these cancers aren't curable, but we're eager to try to support them with remissions and treatments to prolong their comfort, prolong their quality, and enjoy living a long time. Even if they don't have cure, they can sometimes enjoy life for years with control of the cancer.
Is the emotional stress of the illness one of the greatest factors that you have to deal with?
It is. People fear the worst when you're approached with a cancer that we don't know much about. It's oftentimes overwhelming in emotion. Fears, anxiety, sleepless nights, worried what's going to happen next. I'm here to help sort it out with, it's okay, the disease is at this stage, there are treatments available for you. You need support. Now, they may not need symptom management, but they may need approach for emotional and spiritual support. And that's what the team of palliative care, which includes a nurse, a counselor, a spiritual advisor, volunteers, those are people to help support patients who are suffering from advanced cancers.
If not then what is?
I'm sorry.
Oh, never mind that. Not that one. Do you treat just the patients or their family too?
Both. Sometimes the families don't want to lose their loved one either. And sometimes they need to recognize that the patient is in charge of their treatment options. And sometimes patients choose not to have treatment, and that's in conflict with families who don't want to lose their family member. So it requires a lot of counseling to support them. That quantity of life can sometimes be achieved, and it is achieved regularly. However, quality of life is oftentimes sacrificed when we make people try to fight the disease longer and go on ventilators and aggressive treatments that may just make people suffer longer. So it's important to talk to patients and their families together, not separately, not to tell somebody the other is in charge and so forth, but to help them to come to the best decisions for that patient and their families at that time.
What is the difference between palliative care and hospice?
Hospice is for patients who recognize that they don't want aggressive treatments. Sometimes the illness is far advanced and the patients will say, I'm tired, I'm losing weight, I just want to be comfortable, I don't want to go back to the hospital, I don't want to be put on ventilators. And if their prognosis, then that means their life expectancy is predicted to be less than 6 months. Not always is, but usually if the course continues, they may die within a 6-month period of time. Then hospice is a Medicare benefit that patients have to do everything they can for that patient related to that illness. The hospital bed, the oxygen, the medications, the nurse visit in the home. So hospice is basically where the patient is. Palliative medicine and palliative care came about because why is it that the patients who were dying had the best care possible? So all of a sudden, the people who weren't dying wanted the best care too, which is a lot of support for those patients and their families. So palliative care is for people who are in the fight, in the struggle, in the opportunity to live better, to live longer, but they still need emotional support and medications for comfort and their symptoms managed. So palliative care patients have a life-threatening illness and they might die in years, but a hospice patient has a life-threatening illness and chooses not to have more treatment and may die in 6 months or less.
What makes a breast cancer patient transition from palliative care to hospice?
Well, as I just mentioned, sometimes the breast cancer isn't curable, and sometimes breast cancer, though can reach remission frequently, we get to the point where the cancer may spread to other parts of the body. And when it does, families may hear from the doctors that there may not be any more treatment possible. At that point, patients may say, well, if I can't have cancer treatment, I still want medical treatment. And at that point, there's a transition in terms of, I want to go home, I want to be comfortable, I want the nurse to come out to the house at any hour of the day if there's a crisis, to take your comfort medicines, your support, your nurse visiting, your social worker visiting to help with that. So it becomes a personal decision oftentimes, but sometimes it's a medical decision to say, it's time to go to hospice from palliative care.
How does this branch of the medical field affect you as a physician?
Sometimes physicians are trained to treat diseases, and that's very important. We've done a great job with treating heart failure and lung failure and cancers, including breast cancer. But oftentimes we need to be a physician and treat people too. And everybody who has cancer may all have a different fear, a different symptom, a different opportunity to have discussions about what is most important to them. And we fell short sometimes in being a great physician at fixing the heart, but yet people suffer terribly from other things. Breast cancers can be treated aggressively, but what about the family member who is tired, who doesn't want to go back to the hospital again, or doesn't want to be put on a machine to help sustain their life? those patients need to be heard too. So being a doctor is treating people as well as their diseases. And my obligation is to take care of the patient and their families in terms of explaining things and supporting them and what you decide is most important for yourself.
Right. Is it rewarding at times or depressing?
It's sad, but it's hope. You know, we can't live forever. We will all die of something, and that's sad. But it's also hope that we live with dignity and comfort, and people who love you, and people who take care of you, and people who obey you, even if you are going to die and go to heaven. It's a matter of support. It's very rewarding to give people the comfort they need at that transition in their life. But it's very sad too.
How do you deal with the sadness?
You pray a lot. You love your family. You love your faith. You enjoy working with the people who are taking care of those diseases that people suffer from, supporting the staff taking care of them. I'm not here to do anything different than a cancer specialist. I'm supporting the cancer specialists to do what they want to do to help. And there are some miracles out there. People who get opportunities that we didn't think they had. And maybe those opportunities and those miracles are another month of life, which we didn't expect. Or being able to see their grandchild born, or their daughter get married, or their 50th anniversary to develop. And that's my goal, is to help them achieve their personal goals whenever possible. So coping is a matter of supporting people and supporting yourself as well through prayer and family and community support.
Do you feel that a patient with a strong faith in God has a better chance for survival?
I think people who are very spiritual look to God for a lot of help. And we pray to God for a miracle. We pray for opportunities of getting better. But you know, we also pray for thy will to be done. And sometimes we understand that God always answers our prayers. It may not be the answer we want, but we understand what the answer is and how it relates to our spirituality. For people who don't have a strong faith in their religious beliefs, they have family beliefs and cultural beliefs, and Native Americans may have environmental beliefs, for example. We all have a personal stressor that lives within us, and it may be a faith-based in God, it may be a different religion, that they have their own faith support system. And it may just be a faith supportive community wherever they are. I don't take care of people based on their faith. I support them wherever they are in their faith. And it's important for me to understand that it's not my job to change somebody's spiritual beliefs, because that would cause a lot of anxiety too. I'll support them wherever they are and encourage them to talk among their spiritual counselors or their ministers and faith groups to help feel comfortable with their belief system at that time in their life, because it's very important.
Does family support help make an impact in the outcome?
It does. For example, there are a lot of people who have a fear that there's unreconciled conflict. For example, there may be a relationship between a parent and a child, or two children, and that personal feeling of that patient who is suffering may wish, I can't die unless I know there's resolution and support there. And families will struggle, patients will struggle with dying because their job isn't done, or they feel guilty that they left some things undone. So it's very important that families are all on the same page and the patients are all on the same page. And the most beautiful, if there is such a word, of people who die is when the family's at the bedside and the support is there and the prayer is there and the patient can just relax and be comfortable and take care of themselves as they transition. Sometimes families are struggling with patients who are dying, but they aren't dying right now. They may die in a minute, a day, 3 days later, And sometimes we say to our loved ones, it's okay to go. I'll be fine. Everybody's going to be fine. We'll take care of each other, or the dog. Sometimes they worry about the dog at home. And it's that affirmation